Bindu Menon, consultant physician, family medicine, diabetologist, FemiintHealth. So I'm glad to talk to you about diabetes on this World Diabetes Day. It is very important to make you aware of diabetes in world today. So what is diabetes? Diabetes is a disease that prevents the body from making use of the food you eat to be converted into the energy that you need. The food you eat is broken down into the simpler sugar molecules that finds its way to the bloodstream and gets to the cells. In this process, it is helped by a naturally occurring hormone secreted by the pancreas, that is the insulin. The insulin helps the sugar molecules to get into the cells, thereby being converted into the energy you need. So in diabetes, one of these can happen, like the pancreas has little or no insulin, or pancreas has insulin, but the insulin does not work the way it should. Looking a little into the background history of the diabetes. So researchers and scientists have been aware of this disease for thousands of years. 100 years back, the diagnosis of the diabetes was like a death sentence. The survival expectancy of less than 11 months from the date of diagnosis. But the whole scenario was changed after the discovery of the insulin in 1922. The thousands of people were survived after that. So the current state of affairs is such that globally there are 360 million people affected with the disease. And sadly, it will be like 560 million people by the year 2030. It looks like every family has a diabetic and everyone knows a diabetic in the neighborhood. So this rising trend of the diabetes to the epidemic proportions is quite alarming, and scientists and researchers are looking all the possible ways to tackle it. So what causes the diabetes? It is both environmental and hereditary. The increased incidence is related to the family history, the obesity, sedentary lifestyle, hypertension, hypercholesterolemia, intercurrent infections. Coming to talk about the types of the diabetes. There is a type 1 diabetes where there is a total lack of insulin secreted by the pancreas, and that usually it appears before the age of 30. And type 2 diabetes where there is an increased insulin resistance which appears between the age of 40 to 60 years, but it can appear even earlier. There is a gestational diabetes mellitus where the hyperglycemia can occur in pregnant women without a previous history of the diabetes, and the diabetes disappears after the delivery, but there is a risk of progression towards type 2 diabetes later in life. There are other types of diabetes which include the MODY, maturity onset diabetes of the young, where there is a defect of beta cells of the pancreas. Iatrogenic diabetes, where there is an inadvertent use of the steroids or the exposure to the chemicals can cause the diabetes. Some medical conditions can lead to diabetes like Cushing's syndrome. Some diseases of the pancreas like cystic fibrosis, pancreatitis can lead to the diabetes. So how do you know that one has a diabetes? Usually nowadays we see it's an incidental finding of the diabetes in many cases. But the clinical symptoms that one makes suspicious of the diabetes can be like polydipsia, polyuria, polyphagia, excessive weight loss, intercurrent infections, recurrent infections, and the wounds that do not heal. If any of these symptoms are there, one can go for the blood test like fasting blood sugar, the 2-hour postprandial blood sugar, glycosylated HbA1c, or oral glucose tolerance test. There is another entity called prediabetes, where the hyperglycemia is not high enough to be categorized as diabetes. The fasting blood sugar level is between 110 to 126, 2-hour postprandial blood sugar 140 to 200, and HbA1c levels are like 5.7 to 6.4. It is potentially potentially a reversible condition with a diet and exercise management. But if not treated properly, it can progress towards the diabetes. How do we tackle diabetes today? Insulin is the primary therapy for the type 1 diabetes, and there have been lots of oral medications developed to control the hyperglycemia. Patients can do their blood tests at home, track their blood sugar levels, and connect with the healthcare team. Use insulin, oral medications, diet and exercise regimes to precisely control the hyperglycemia, thereby reducing the risk of complications. Complications can occur at any age, at any stage, like diabetic nephropathy, retinopathy, peripheral neuropathy, coronary artery disease, diabetic ketoacidosis, hyperosmolar hyperglycemia, non-ketotic coma. These complications can be very, very disabling and life-threatening. Hence, the importance of early detection, personalized diet and exercise regimes, individualized treatment protocol, regular monitoring of the renal, cardiovascular, eye parameters cannot be overstated. What holds future for diabetes? Future for diabetes looks bright with concepts that can be transformative if worked well. One of which is the artificial pancreas, that is the automated insulin delivery. Second is the beta cell replenishment or the transplantation of the beta cells. And third is the glucose-sensitive insulin, where one dose of the insulin can last the entire day, sensing to the rise and fall of the sugar. So having said all these, the take-home message is, you have to take charge of your own health. There are small things that you can do, which can have a tremendous impact on your life. First of all, which is diet and the exercise, which is the best you can do. So eating well, staying active, getting good amount of sleep remains the foundation for the successful diabetic treatment and a healthy living. Thank you.